Good afternoon and welcome to the session Healthcare Environments, Welcoming the Public with a Sense of Comfort and Security. I'm John Zarnecki, Deputy Director and Senior Vice President of IIDA. I'll be the moderator for this session, which is presented by IIDA, the International Interior Design Association. Thank you to the HCD conference for this week's virtual program. IIDA really appreciates our relationship with HCD and Emerald Expo. And this is the last session of the conference. So thank you all for joining us, for being here with us. We'll be sure to make it a worthwhile final session of the conference for everyone watching. And for those that had attended HCD in person in recent years, you know that IIDA regularly hosts a luncheon discussion sponsored by Construction Specialties. Well, we're not able to be in person to have a luncheon this year, but we're very pleased to have Construction Specialties support IIDA by sponsoring this online session. So thank you to our friends at Construction Specialties. As we start, a quick note on continuing ed. This session is approved for one CEU from IDCEC for interior designers. Further information on that is on the screen right now. Those who are watching this live, your name and email address will be forwarded to IDCEC for that credit. In this session, our focus will be primarily on public spaces of healthcare interiors, the entry sequence, from arrival at the front door to waiting areas and reception. What is the patient experience? What is the experience for family members and caregivers? And how is this pandemic changing and going to change design strategy for the way that the public interfaces with the healthcare environment? The conversation, like many you've watched this week, may stray a bit given the unusual year that we're all in, but that is the general focus of this discussion. We have four esteemed healthcare design practitioners with us. Let me briefly introduce them. Lilliana Alvarado, IIDA, is design principal of her own design firm, UPHEALING, based in both New York City and Bedford, New Hampshire. Edwin Beltran, FIIDA, is a design principal with the firm NBBJ. He's in Florida right now, but he's based out of the NBBJ Columbus, Ohio office. Edwin is also a recent former international board member of IIDA. And this panel is special because we have two people who happen to be both healthcare professionals and design professionals simultaneously. Whitney Hendrickson is a registered nurse and past board member of the Nursing Institute for Healthcare Design. She recently was a healthcare interior design professional with the firm Perkins & Will for 5 years. Whitney is based in North Carolina. And Dr. Manny Hernandez is an emergency medical physician, as well as a principal at the architecture and design firm Kahler Slater. His focus is translating operations strategy and the consumer experience. He is based at Kahler Slater's new office in Chicago. Welcome to all four of you. So let me describe to our audience the format for this session. This is the second of two IIDA sessions in this conference today. So some of you may have seen this format in our earlier session too. The bulk of the hour will be a conversation among the five of us, and we will try to save some time at the end for audience questions. So if you have questions anytime during the session, just type it into the Q&A box that you see at the bottom of your Zoom screen, and we'll take a look at those for the end of the session. To start the session, each panelist will be presenting a small handful of slides, Pachakacha style. What is that? That is a type of presentation in which slides are shown for exactly 20 seconds each. No more, no less than 20 seconds. As the presenters say something briefly about what is on screen. So this is a fun way to essentially get us going, to quickly see some images and hear from each individual panelist without having a long slideshow. And then we can have a panel discussion among the 5 of us. So Dr. Manny Hernandez has agreed to get us started. Dr. Manny, are you ready to show your slides?
I'm ready to go if you guys can hear me.
We can, we hear you, we see you, and here comes your first slide.
All right, so we're gonna start this with the notion that really when we think about safety and comfort in healthcare, our day of reckoning in healthcare has really arrived. I think COVID-19 has taught us that a lot of things that we thought were being valued by our consumers were really somewhat superficial. And at a time when we were more planning to experience, now we're needing to think very, very thoughtfully about how we balance the aesthetic elements of satisfaction along with things around safety and security that are tied to infection control, that are tied to personal and physical safety and workplace safety for our provider consumers. And we're faced with a daunting challenge right now because about 70% of our consumers have reported that they're afraid to enter the hospital right now out of fear of catching COVID or something communicable. And in our workplaces, healthcare workers are 5 times more likely to be the victims of workplace violence than folks in other service industries. So as we go forward, we need to be thinking very differently about safety and comfort that we have in the past. We need to really be thinking about how we are designing to pan-pandemic environments, not just COVID-19, but also other types of pandemics that may arrive, other ways that infectious diseases can be transmitted. And we also need to be thinking very carefully about all the spaces that we create and the environments to allow for active and passive security that are relevant and appropriate to the environments and the communities in which those things are being designed today. So ultimately, what we want to really think about here is that meaningful balance of aesthetic, of comfort, of safety and security, and really beginning the process by identifying what success should look like as we design to these areas, and then what we might be thinking about differently and designing for in the future.
Great, thank you, Manny. Next, Lily.
Yes.
Are you ready to show your slides?
I am ready to show the slides.
All right, here we go.
Well, thank you, John, for the lovely introduction. We have been seeing this cross-pollination of interior design sectors for a while, and COVID has unified all of them more so than ever. I think no matter where we are, be it a school, supermarket, or hospital, we're all concerned about the same thing right now, which is our health. And hello, thermometer. We have been designing for the patient experience for a while now. And all of a sudden, this is how we're greeted in person. Thanks to this procedure, my 2-year-old is now terrified because someone pointed this device to his forehead without a warning. And I can understand now how frightening that experience could be for some, maybe some with autism or different types. And we understand that this virus came at us fast and furious, and we're all trying to come up with any solution to get us through this current situation. Obviously, what we see here is not going to work long-term for patients having to wait. So what's the alternative? And in some cases, some places are having patients wait in the car in less urban areas, of course. Some might simply have to wait outside. I have personally experienced this scenario while taking my mother to her medical appointments. And for us, it seems to have worked quite well. The only thing I will say, the one saving grace I believe about dealing with COVID during 2020 and not 1920 is the access we have to technology. We've been able to stay virtually connected like we are doing right now with one another, and that includes our doctors and therapists. And I think no matter what solutions we come up with to address the needs of today, we need to be considerate of others and try to understand that everyone has a different experience and situation in healthcare settings. And we need to design our spaces with empathy for everyone to experience. Some are having different issues than others, and I think we just need to address that.
Great, thank you, Lily. That's excellent. Edwin, are you ready to show a few slides?
I'm ready. Let's go for it.
Let's do it.
All right, so if there's anything that we have learned from COVID is that it has completely upended the experience equation that we have all become accustomed to. So, you know, things were reduced, everything was prioritized around safety and clinical accuracy, and how can we take a more integrated approach, one that is more resilient, where all those elements are more equitable. One of the things that we immediately did as a firm is, as we continued to observe what was happening, is like, how can we help offer ideas to mitigate the stress and the mental anguish that the frontline workers were beginning to experience. And there was a series of ideas that we explored, taking insights from neuroscience for that. Also, understanding that by the summer, many of the healthcare facilities were losing in the tune of $50 billion a month. How can we begin to think of alternative scenarios where doctor, you know, given the success of the drive-through testing, can we think of that as a way to think of alternative clinics? And as technology continues to improve, you know, think about wearables, think about telemedicine, can we think of different ways in which healthcare can actually be more convenient and more pervasive in the way in which we live our lives? Also, you know, one of the things that we quickly learned is, and one of the most kind of challenging things was the loneliness that people with this disease were feeling when they were in the hospital. How through design can we facilitate physical, emotional, and virtual connection with family members, because that was so critical. And then the last slide that I wanted to show here is like, sometimes we have to look look back to move forward. And, you know, how can we move from the, you know, these ideas of access to things that are more about humanized institutionalism and what is truly essential.
That's great. Thank you, Edwin. And Whitney, are you ready to show your images?
I'm up. Yeah, let's do it.
Let's do it.
So I just wanted to show a couple of images of various projects I've worked on. You know, we as healthcare designers, we're always doing, you know, clean and wipeable surfaces. You think about solid surface arm caps in your furniture, and, you know, you work with facilities on what cleaning agents they're using. We often, you know, test those methods and figure out if what we're specifying works for the facility. But, you know, we're faced with challenges now of not knowing what we're dealing with COVID. So this isn't our first pandemic, and it won't be the last. So keeping in mind that, you know, staff visibility component, if, you know, are triage functions happening at unusual locations? Are they closer to the entry point? You know, access to outside has always been a part of our, you know, biophilia and, you know, approach to laying out a waiting area, for example. But, you know, access to technology, how are those surfaces being wiped down? Who controls the screen? You know, dispersing seating groupings is something we understand, but as Lily's slide showed, you know, simply putting tape over a chair isn't the most attractive solution. And it's not just taking out all the seats, right? Or adding a PPE stand. You know, how can we be smart with locating, you know, hand washing stations, and, you know, departments like a NICU, obviously hand washing is really important. You know, there's additional signage needs, but, you know, incorporating those components with art and more of a feature idea could be something we look at going forward. Access to staff, even for those compliance needs regarding hand washing and those thermostat checks. Even, you know, laying out a waiting room, you know, we typically do zones by way of just the concept of choice, but giving social distancing requirements, it's nice to have some of those zones, you know, lend itself to what we're looking at today. So.
Great, thank you, Whitney. And thanks to all four of you for essentially playing along, for showing your images quickly, 20 seconds each. It's a great way, again, to show images quickly. And now we build upon what you had just described in conversation for the next 45 minutes. All of you had brought up some really key elements that we can build upon. And I'll turn to Manny and ask us to expand on the concept of the importance of first impressions in healthcare and how that has changed this year in your mind.
Yeah, I think we've learned a lot of lessons about first impressions this year during COVID-19, and some of those have been very positive lessons, and some of those have been very negative lessons that we have learned. But what we certainly have learned is we need to think very differently about how individuals, both patients and visitors, as well as providers, are accessing our environments, and how we can ensure them a balance of safety and experience. When COVID-19 first hit, and even today, our hospitals have gone into pretty aggressive lockdown in order to attempt to mitigate the transmission of COVID and protect everyone. It's had some unanticipated consequences of while we have attempted to tell a story of safety and quality and trying to protect everyone, it has created challenges. As we talked about earlier, patients who have felt isolated from family members not being able to participate in medical decision-making, being at the bedside at end of life, being at the bedside at beginning of life, just being able to escort a family member who maybe is disoriented or confused into the emergency department. It's created a lot of challenges. And so I think what we really have to think about is to go back and begin to ask ourselves of what is it that we are truly attempting to accomplish on those first impressions, and how the first impression begins to inform the entire patient care journey, whether that first impression is a virtual first impression, a physical first impression, or a combination of the two.
Mm-hmm. That's all really important. And one of your lines, one of your key points that you made when you showed your slides was the phrase healthcare and healthcare design's day of reckoning has arrived. Do you want to?
It has.
Do you want to expand on that a little more?
Sure. I'm happy to. As a clinician and a designer, I've really had the opportunity to kind of see both sides of this. And I think for a number of years in healthcare, we have gotten lost in the desire to really design experiences that are more aligned with what one might experience in a hotel or in some other types of hospitality environments, with the understanding that elective procedural volumes, elective patient populations generate profitability in healthcare organizations. And so we wanted to create these very nice, upscale 5-star experiences that focused on comfort, focused on amenities and aesthetics. And all the while, we were not spending as much time as we needed to thinking about these basic elements of safety and security. We certainly had our infection control colleagues out there trying to guide us and make sure that we were doing everything we could, but we never really planned very well to what would happen if a pandemic like COVID actually arrived. And so now we're here, and all these solutions that we're trying now are kind of a pasta against the wall approach, a lot of overcompensation, some undercompensation in some environments. But I think what we have learned in all of this, what I hope people have learned, is we're designing hospitals and healthcare environments, not hotels. And so first and foremost, we have to be thinking about how healthcare organizations need to function during normal operations and during periods of disruption, in order to make sure that we are taking the best care of everyone that we can, whether those are patients or visitors or staff. So I think we have a lot of thinking to do when COVID is over about how we're going to view things differently without having knee-jerk responses and just over designing to solutions as well.
Thanks, Manny. And I know that concept of the influence of hospitality design is interesting, and we're going to definitely get back into that within the hour. I want to ask Whitney, building on what Manny had said, with your experience as a nurse and a design professional, what in your mind can healthcare professionals bring to the conversation at this critical time?
Yeah, thanks, John. I mean, fortunately, I've heard this a lot over the last few days of this conference, which has been really refreshing. But I think taking the time to really listen to our teams, our clinical users, really hear what they've gone through over the last year. You know, burnout is real, and our users are in a state of PTSD, to be honest. So they're really looking to us as on the design side as allies, to meet them where they are and to truly be the expert in our recommendations, right? So thankfully, the architectural design process is pretty similar to making a clinical diagnosis. You start with observation, you gather the details into more of a formalized assessment, and then finally, you know, we have a diagnosis or a treatment plan by way of our recommendations. But I thought it was interesting, back to the over designing and the knee-jerk reaction. You know, no one really knew what we were dealing with at first. And so it's not just about putting up quick screens and plastic dividers everywhere, or just taking out half of the chairs in a waiting room. So it's about, you know, partnering with these facilities and users and saying, what have you seen in the last 6 to 9 months, and how can we meet you with a solution that works for you, but that's also flexible? Because if we know anything, is that we don't know what tomorrow will bring. So on the design side, we need to be prepared for our recommendations to be nimble and to flex as time goes on.
That's really good, and I like that analogy quite a bit of the design process similar to the clinical care process, of both involving observation, assessment, and recommendations of a plan.
Mm-hmm.
And that's something that this is where evidence-based design meets evidence-based healthcare, right? So it's
Right.
it's an interesting moment tying in with Manny's concept of the moment of reckoning that we're here. Turning to Edwin, I know when we had Edwin, we have spoken previously about looking at the big picture of the physical space of healthcare and the real estate impact of public spaces of healthcare. That everything is being reassessed. Lots of things in life are being reassessed, but specifically related to healthcare, physical spaces and the real estate needs of the public areas of healthcare being reassessed. Can you talk about that more from your experience?
Yeah, you know, one of the things that we are beginning to notice in projects, and actually just speaking about space in general in healthcare, there's a shift in mindset. There's a shift in mentality from, you know, from the prior medical center hub type of approach to one that is much more network and satellite. With that comes an evaluation and an assessment of the space that is available in each one of these large medical centers and campuses. You know, understanding that a lot of times between 20 and 25% of the space of the real estate in those campuses is allocated to administrative functions that a lot of times don't add any real value to the outcomes of the clinical mission of those facilities. So we're beginning to see that type of program being questioned and being sent to facilities in a satellite manner, and a lot of times actually in a way that is closer to where the workplace lives, to the people that work in those facilities. So it's closer to them. So that brings some value. Also, that space then is being replaced with new facilities that are imagined or developed in such a way that is much more flexible, hyper flexible or adaptable. So, you know, planning modules that would allow anything from inpatient type of functions to outpatient functions, procedural platforms, or even research, because, you know, we have seen an increase in terms of the bench to bed type of research connection more and more. And lastly, technology through this has allowed us to see that we can better choreograph experiences. So, spaces like the waiting room, I think could be completely reconsidered. Just to give you an example, we're working for a large medical system that is completely questioning the role of their gift shop in their campuses. They're saying, why couldn't we adopt something that is a little bit more of a pop-up type of situation, or like kind of the markers, farmers market type of approach, and then use the space that used to be the gift shop as a storefront for concierge type of services for the staff. So like, as Whitney was saying, we're beginning to see the PTSD that this has created on the staff. So how can we think of those spaces that are available on the campus, but turn it in a way that is going to be of value to the staff in those medical centers?
That's good, Edwin. And I like that concept of hyper flexibility and ultra adaptable, welcoming public spaces, as opposed to one of Lily's slides showed the tape over every other chair in a waiting area. You're advocating for ultra adaptable environments that it's up to the operations of the client to ultimately do the adapting when it comes time to adapt. But you're saying it's possible, as opposed to the taping of every other chair and a more rudimentary solution.
The other thing that we're beginning to see, John, is streamlining of the public spaces and beginning to think of outdoor environments in a much more critical way. So those can be program spaces that could be added to the experience, to the public realm experience. And obviously they come at a much lower cost than an interior built out environment.
Mm-hmm. And Lily, connecting back to what Manny had described related to his thoughts on hospitality design's influence, I want to hear your thoughts too. First, I want to point out, I love that you have an IIDA New England award right behind you.
I have two of them. But yeah.
Great placement. I just noticed that. So good job on that. But so Lily, you're in your practice, your work is in healthcare design as well as other project types, I know. And so specifically with healthcare design first, what are your thoughts on this influence of hospitality design on healthcare interiors and the importance of focusing on health for healthcare interiors?
Well, I think there are two big things that I can talk about, but when it comes to hospitality, I do have to echo a lot of like what Manny said. We've been seeing hospitality design elements already having a great impact on healthcare interiors for quite some time. This isn't anything new. We've been doing this for a while. And the design approach has helped ease the mixed emotions that we feel when we visit a healthcare facility. I mean, nobody really goes in all excited because, hey, I'm having a colonoscopy today. Everyone has like all these different senses of just scared, I guess, in different ways, whether it's pediatric, whether it's geriatric, whether it's a procedure, even drawing your blood, like something simple. It's never like a fun experience necessarily. So I think having those design elements from hospitality does help alleviate some of that nervousness that we all perceive when we go into a setting like this. One thing that I am extremely pleased about is starting to see these hospitality elements start to go into the staff areas. And because all in all, we approach a lobby and it's a good first impression, just like the vestibule of your house, it's your first impression. But the people that are there, on these long shifts, that they're there dealing with what we're dealing now with COVID, they're dealing with PTSD, and they go and they have a balcony, they have a little place of respite, just a few minutes to recharge. that's where I really like to see hospitality also being brought in versus just, the main space. It's really the people that are using it on the staff side. Now, in some cases, I do agree as well that maybe we've gone a little overboard, and when we're going for certain procedures, it's still a hospital, and it still needs to look clinical. And I think having it actually look clinical in some cases may give a patient comfort that they know that they're going with, they have the best technology and the best doctors and the best procedures that they can have for their what they're getting done. So, that's that part. But I think all in all, hospitality, we always have to start with having the infection control conversation upfront before we even put pencil to paper. And we have to have these conversations with facilities, what their cleaning protocols, and having these parameters set that will help us come up with the right design solutions before we even start the process. So what I think is going to happen, maybe because of COVID, these temporary solutions are just temporary. We're just trying to, like Whitney said before, we're just trying to get through it for the moment. But what perhaps we'll start seeing, we were getting to a point where we were very tactile, and we would go into a pediatric space and there were like all these sensory things that the kids could play with and whatnot. And maybe that turns more into like a visual, like a light rain or something more like interactive visually, or in lieu of like germy toys that can spread different things. So hopefully,
Yeah.
So that's what I'm thinking of. Things are gonna start happening.
Thanks, Lily. And Dr. Manny, do you want to build upon or add or debate anything related to that concept of the balance of beauty and safety in healthcare interiors?
Well, I'm always up for a good debate. But one of the things that I am completely aligned with Lily on is, and what other folks have also mentioned here as well, is that I think we have also really begun to realize that we have neglected the caregivers. And this notion of caring for the caregivers is going to become far more important as we move forward. And a lot of times those spaces, those amenities that we've talked about have been shared amenities between visitors and staff. You think of the Starbucks in the hospital lobby, or the gift shop, or the cafeteria. Those have been spaces that have been shared. And when we get to points like we are today with COVID, where we need to segregate different types of people to maintain everyone's safety, those notions of shared amenities become really difficult. The other thing is, and I want to clarify a little bit about what I mentioned earlier about, our day of reckoning is here, and we're designing hospitals, not hotels, is the challenge has always become, I think, not necessarily on the design industry side as much as what gets value engineered out of a project when we are faced with tighter budgets and financial decisions that need to be made. And I think we've learned some very valuable lessons here, that we haven't designed our facilities to be as flexible and adaptable as they've needed to be. And we've talked about the hyper flexibility of spaces that we want to create, which are important. But I can tell you, as someone who is still practicing clinically, I was just working in the emergency department this weekend. My biggest problem isn't always necessarily space, it's staffing. We just don't have enough people. So the people we have need to be as productive as they can possibly be, so that when I'm thinking about environments and spaces, I'm thinking a lot about how those environments will enable me to be maximally efficient and productive and safe. That is, I think, one of the most important drivers for me. And the other thing of that is, particularly around first impressions, we have first impressions in the emergency department, with people walking in the door with everything from, I might have COVID to, hey, I have this knife in my back, would you mind taking it out? We have a combination of those, and we need to be able to make sure that those first impression environments still enable us to, again, care for the people we need to care for, and also identify the things that we need to have our attention and eyes on first. So really, in those first impression environments, maintaining a level of situational awareness that is critical for us to avoid medical errors, avoid delayed diagnoses, and avoid putting anybody at risk, whether it is patients, visitors, or family.
Mm-hmm. Whitney, building upon that, because you are also both a healthcare practitioner and a design practitioner, thinking about your peers as design peers, what do you recommend as tools or examples, given this wide background that you have, examples for the designers to advocate for flexible design and choice?
Yeah, I think it's nice that you say advocate. That's a primary function of any clinician is standing in as an advocate. And what's neat on this side of the table, and I'm sure Manny would agree, it's you're an advocate in a different way, sort of a larger scale with a different set of tools. So I think HCAPs were a driver on the facility side for renovation needs, but now it's safety and infection prevention, right? So back to the emergency department, ICUs have always struggled with violence to staff as well. So if germs have always existed, how do we plan for flexibility, knowing that it's not just now that people need to wash their hands, but you also don't want to inundate people in that entry sequence with overwhelming signage and PPE stands that are not effective. So allowing additional space at the entry vestibule sequence, perhaps, working with our engineers for additional mechanical ventilation needs. I think PPE should have always been planned thoughtfully. A lot of times our facilities kind of handle that application on their own, and it's part of my weird pet peeves in design meetings to make sure we smartly plan for those, because the general public, as we've seen, isn't aware. You've got people at McDonald's wearing gloves to hand out food through the window, right? Like, when are gloves effective? How are they utilized? So having a staff member next to a PPE location, how do you need those? How does that impact space, right? Because it's about education and compliance too. From a life safety perspective, hand sanitizer quantities and distributions and locations have to be something we think about. But working with the infection prevention team on those placement and knowing that is going to be a system and an answer that's going to stick around. It's not going to be taken down as far as this pandemic goes away. So those signage implications and all important PPE is always a problem for us, but it's a problem we need to figure out how to be smart about.
Great. A reminder for our audience, we've only got about 20 minutes left. If there are any questions, feel free to type them into the Q&A box that's at the bottom of the screen. We'll try to get to any questions near the end of the program. I want to take advantage of the expertise we have here, knowing that also some in the audience are designers with other project types, and we're all thinking big picture too. Edwin, your firm NBBJ is also a firm that designs many workplaces, and many of our IIDA members are experts at workplace design. Just want to take a minute here to deviate off of healthcare for a moment to hear your thoughts related to healthcare design's impact on the corporate workplace design arena here we are as we're about to enter 2021?
You know, John, one of the interesting things that we have seen as part of the pandemic is that now there's a recognition of the value that healthcare designers bring to the table, of the voice that we can have in the conversation. I believe that as designers, you know, we operate in a world that can be at times pragmatic and at others aspirational. We know how to balance something that is highly functional with something that is extremely humanistic. We know how to operate between both worlds. And we are now being invited to the table to be part of those conversations in workplace environments. Conversely, you know, a lot of the lessons learned on workplace would not necessarily apply to healthcare environments. Like, you know, we have learned a lot about working from home. So, you know, in the workplace, where we're beginning to see that the office is going to be somewhat different, we will have to encourage people to come back as a place to collaborate. We can do the focus work at home. That might not apply to every function in a hospital setting, but it can begin to play a role in the way that we begin to think about those caregiver environments that Manny, Lilliana, and Whitney have spoken about. The other way that I think about it too, I think of workplace as a way to, as this toolkit, as these, where we can test ideas rather quickly. So, you know, if I take, for example, you know, the connection to nature, biophilia, we explore some of that at Mass General in terms of the connection of to nature in relationship to the ICU beds. It's explored in a limited manner. However, you can go then and see what was explored at the Amazon's sphere, where the workplace itself is in nature, and we know the benefits that bring. We could have never gotten to that exponential level of exploration in healthcare. So it's a good way to have a dialogue back and forth to continue to push ideas between different marketplace and different practices.
Mm-hmm. And I should have mentioned before I handed it off to you that, of course, a healthcare setting is a workplace, whether it is caregivers, food staff, and there are offices, of course. So we are definitely talking about the workplace of healthcare. And as Manny had said, caring for the caregivers is absolutely key in this discussion as well. And Lily, with that thought in mind, I know that your work has a very human-centered approach. Tell us about how you're bringing that to the other sectors, the other project types that you're working on as well.
Sure. And I think right now we're all concerned about the same thing. It's all our health and the health of our families, no matter what building type we're in. You know, we're concerned about our kids going to school, taking the bus. You know, we're concerned about, you know, going to the supermarket, anything that has to do with our daily lives. And I think, as I mentioned before, COVID has unified us in many ways. And I think the silos, like we mentioned, like Edwin talked about, the silos that we had in interior design are just, they were already starting to crumble, and we're starting to see, we're starting to hear things like residential and bringing hospitality elements into healthcare and corporate and educational. But now we're seeing like the flip side. So instead of bringing in everything that's like pretty and cool into healthcare, now we're being asked to incorporate highly cleanable products, for instance, into other environments. And it's not as simple as that, but we are looking at design universally for everyone. For example, I'm working on a residential tower right now in Boston, and we're taking a completely different approach with cleaning protocols because we're keeping tenants in mind and their well-being because of my healthcare experience, which would have been completely very unusual during normal times to look at a project from that perspective. And I think with that being said too, there's a mental wellness component that needs to be considered too. And part of it is all perception and what makes us feel safe and comfortable. And for some people, it is, you know, walking in with wipes, and some other people maybe not. But I think that's where I was trying to mention how we have to meet people where they are and just look at everyone and trying to just help everyone's psyche, I guess, too, is just as important as everyone's physical health during this time. So just because something, it's all about perception, right? Does it look clean? Is it cleanable? Is it actually cleanable? So, what we perceive is also part of our well-being. So I think that has to be considered.
Lily, if you can expand a little more, say on the residential project, it's a large tower that you say in Boston. You mentioned cleanable surfaces. Beyond that, are there other aspects of, say, your healthcare expertise that client is really looking to tap into in terms of what they want in terms of designing a residential tower? I think about it because I am right now in a residential tower that is safe and secure in multiple different ways. Are you having those conversations with clients?
Absolutely. So I'll tell you, we split our time in New York City as well, and we also live in a tower. And you can't go take out the trash without wearing a mask, and you can't have anyone in the elevator. We have all those protocols in our building as well. The conversations we're having with this particular client is we're looking at HVAC systems. We're looking at different door systems and how things are opened and touchless. We're looking at all of their cleaning protocols in this instance. And one of the things that we're looking at, which is a little bit different, is because everyone is working from home, not everyone, and John and I actually experienced this, not everyone can work from home, two people in the same household in the same room because they talk. And so we're actually having some individual workstations in the building that people can access that can be easily cleaned and quiet and safe to get away. And so we're incorporating a lot more of that as into the amenity spaces that perhaps before were not such a big issue.
That's really interesting. And I want to bring it back to healthcare design. And Manny, a follow-up question for you. It's a bit of a curveball, but I thought of it as you're describing talking to clients, and you have pointed out that your role is translating operations strategy and the consumer experience. When you're having your conversations with, say, a new client or a prospective client with Kahler Slater, are there preconceived notions that they have now this year of what their project, what their facility should be, could be? And are you needing to, say, dispel myths and talk through a realistic set of outcomes and goals for projects in a different way that you hadn't experienced, say, a year ago?
Sure. So first of all, okay, I'll tell everyone our secrets. So I'm seeing a couple of things out there. So I think the first one is everybody's just confused right now. Most of our clients in healthcare are still trying to figure out what the long-term implications are going to be from what has happened with COVID. They've taken an enormous financial hit. They have seen their volumes scatter in ways that they hadn't expected before, including some shifts to telehealth, some of that starting to come back now into the in-person environments. And they're also seeing themselves lose volume to disruptive competitors who are better at offering digital solutions. So our clients are trying to figure out what all this means, and they don't know yet. And so, what we're really encouraging, what I'm encouraging all of my clients to do is to take a step back and do some scenario planning and really think about the different ways this could play out. Because we're not just dealing with an economic pandemic right now, we're also dealing with a financial crisis. We are a country that is now in recession. We have had 18 million new people in our country become uninsured or underinsured in the course of this year. And those things have had a very real impact on what we need to be thinking about in healthcare. So we've got to think about that. The other thing that we're talking to, we're hearing a lot of clients now that are wanting to look at, particularly in workspaces, socially distanced workspaces, contactless workspaces, keeping staff socially distanced. And I think it's really important in healthcare to understand function and intention and culture in healthcare, particularly in workplaces. There are places in healthcare where socially segregated, socially distanced strategies work really well, and there are other areas where they don't work as well. Healthcare is collaborative. We've spent the last 15, 20 years talking about interdisciplinary healthcare and getting people to collaborate with one another and being physically adjacent to one another to improve collaboration. And the research has shown that that has worked. If we segregate people too much, we risk losing the creative collisions that are necessary in healthcare. We also risk the mentoring opportunities that our younger clinicians get from being around our more experienced clinicians. So we have to be really careful as people are trying to figure out how to solve these challenges to, again, not overcorrect and to not go to solutions that are going to have a different unanticipated consequence that in a different way could impact quality outcomes, experience, emotional well-being. So I think more so than ever, we need to be so thoughtful, and we need to not assume that we know anything walking in the door, and we just have to ask a lot of questions and look and listen and learn and really collaborate with one another to find the right solutions.
That's really great, Manny. Edwin, you're with one of the larger firms in the country. Building on what Manny had just said, are you having similar experiences with your clients this year?
Yes, and actually I wanted to not only to support what Manny's saying, but when it comes to the idea of collaboration, we have to also take into consideration the multi-generational workforce that
Yes.
our healthcare clients have. So I've seen situations where we have gone on a model where we want care to be more personalized, but the nursing or the caregiving staff, because they're younger, they're needing the mentorship. They thrive on the collaboration that is happening with more senior staff. So we have had to open and completely change the models that we were proposing to support that. So that is just to indicate that yes, culture is extremely important in making sure that the environments that you are creating are going to enable that.
There are 4 generations of healthcare workers all working in the same space right now, and we've all learned healthcare in a very different way. And that, Edwin, you're absolutely right. That cultural piece is so important to what we do.
That's really interesting. And Edwin, I think you had pointed out, well, I think that this point has been made in this session and in others. This will not be our last pandemic. Hopefully it's not anytime soon, but we have to prepare. So how do designers continue to advance design for healthcare, especially the transition of the public spaces to the healthcare interiors, knowing that similar situations can and will likely happen again?
So you are correct, John. I think research is beginning to suggest that that global warming and climate change is beginning to expedite the release of microbes and pathogens into the environment that our bodies are not accustomed to. Therefore, we don't know how to deal with those yet. So just think for a minute about the last 10 years, swine flu, multiple avian flus, SARS, Ebola, and now COVID. And this is not the first COVID. There has been multiple before this one. So we're beginning to see this happening more and more. So what does that mean for healthcare environments? We will have to be designing in a way that is constantly thinking about pandemic mode. So that will have to be integrated into the way that we're looking at the planning of our facilities. I see 2 potential vectors of opportunity. One of them is physical. It's about the physical environment, and we have already mentioned this word multiple times. Hyper flexibility, hyper adaptability? How can we, at a moment's notice, change the safety protocols within within an environment? How can we begin to detail the environment to really promote and support the infection control protocols that some of these facilities have? And even going to the engineering side, how can we begin to create environments that are going to be healthier? So thinking about like the air changes that happen within those environments, I think there's great opportunity there. On the psychological side, and I believe Lilliana made this point, safety and cleanliness are going to be the new symbol of comfort in this environment. So that is going to be the new thing that we will have to work with. And the reason for that is because it's going to promote confidence for people to come back into these facilities. And I think the last point then is like hygienic protocols that will become the norm, and how can we begin to celebrate those in the facilities that we're designing, so they can become rituals that become part of experiencing and entering these facilities in a way that is mindful and beautiful.
And as we near the end of this session, I think about what an interesting moment this is, as Manny uses the word reckoning. I like just repeating that, but it is just for the design professionals, for the four of you, and then especially Dr. Manny and Whitney, to have backgrounds in design and healthcare. Years ago, we wouldn't have seen that hybrid of a professional. And maybe this is a moment where there will be also more hybrids of interesting professionals bringing one set of background into another. And so I think it's really an interesting time where we will have more people like Whitney and Manny who are both healthcare professionals and design professionals bringing your expertise here. So thanks to all four of you for being a part of this. I'll ask my colleague to bring our final slides on the screen. And just a reminder, for those that are interior designers watching this session, that this session is available for one CEU from IDCEC, and your name and contact info will be forwarded to IDCEC for that credit. So that'll be a seamless process. And thank you to everyone. First of all, to all four of you for joining me today, for offering really tremendous insight and an excellent hour to end the session, end the conference. And thank you to Construction Specialties for sponsoring and supporting IIDA and this session in this unusual year. So thanks again, and enjoy the rest of your day, everyone.
Thank you.
Thank you.
Thanks, everyone.
Thanks, everybody.
Good night.